In myeloma clinical trials, researchers use standardized response criteria to measure how well a treatment is working. Having uniform response criteria is important because it allows doctors and researchers to consistently compare results across different studies and better evaluate the effectiveness of new therapies. Terms such as partial response, very good partial response, complete response, and minimal residual disease negativity help describe the depth of response. In general, deeper responses are often associated with longer remissions and improved outcomes. In this HealthTree video, we'll review the response criteria commonly used in myeloma clinical trials and explain why depth of response has become such an important measure in modern myeloma care.
What is the response criteria used in myeloma clinical trials? What is meant by depth of response? Why is depth of response important?
All clinical trials will have different criteria for inclusion, exclusion, what they're defining as response, but in most cases, we all typically use the IMWG response criteria, the International Myeloma Working Group criteria. It's typically what we use for their diagnostic criteria as well as for response. So there's various time points or disease points that you hit to see if you get into what's called a partial response or a very good partial response, a complete response, or stringent complete response. So partial response, usually if you have a 50% reduction in your marker, so your M spike essentially is dropping 50%. Very good partial response typically refers to having a 90% or greater drop in your M protein, and then a complete response is having normal blood markers and a normal bone marrow biopsy. So those are the response criteria that we typically use.
What is depth of response and why is it an important measure?
The depth of response means, how deep are we getting a cleaning of your bone marrow? How negative or how normal are your blood markers? And that depth of response makes a difference. What we see consistently is that the deeper your response, the longer it takes for your myeloma to come back. And that kind of makes sense, right, inherently. If we are able to get a complete response versus a partial response where there's only a 50% reduction, it's going to take that much longer for your myeloma to come back. And so that's why depth of response matters and why we are trying to get to the deeper responses.
Understanding response criteria can help patients better interpret myeloma clinical trial results and understand how doctors measure treatment effectiveness. Standardized criteria allows researchers to compare therapies more accurately, while depth of response provides important insight into long-term outcomes. We hope this HealthTree video helped clarify these key concepts. Be sure to watch the other lessons in this series to continue learning about myeloma research and treatment advances.